Now, let me break down something that may shock you in terms of one of the most prescribed drugs in the history of the world. I'm a cardiologist. Many of you listening to this may know of somebody, or yourself may be taking a statin. A statin is a cholesterol-lowering drug that is there to potentially prevent heart attacks, and also people who've had heart attacks who are high risk to prevent further heart attacks, okay? Now, I've independently analyzed the data. This is well known. This is published, and people can look this up. If you want to go to a website to look at many different drugs and the actual benefit for you as an individual at best, then you can look at this website. It's called thennt.com. THENNT, numbers needed to treat.com. So let me break it down for you. Most people in America who are taking statins are what we call not high risk of a heart attack, okay? And it's estimated that at least 30 million Americans are prescribed statins. Globally, between 200 million and 1 billion people are prescribed this drug. Now, if you are taking this medication, based upon drug industry-sponsored data, okay, which again, has not been independently verified because this is best case scenario, but this is from their own trial data. When you look at it and you break it down, what is the benefit for you as an individual taking the statin drug to prevent a heart attack? For most people, this is irrefutable evidence. Nobody can counter this, but you've probably never been told this before. If you trust the drug industry-sponsored data, if you don't get side effects, and you take the pill every day religiously for 5 years, because that's how long the trials last and when they've been tested, there is a 1% chance, a 1 in 100 benefit, that that pill will prevent you having a non-fatal heart attack, a non-disabling stroke, but without prolonging your life by 1 day. Think about that for a second. Were you told that by your doctor? Your doctor probably doesn't know this. You know why? Because we as doctors in our training were not conditioned to be able to interpret information in this way and then communicate it to patients. But this is the most ethical approach when it comes to informed consent, and that needs to change. So there's a 1% benefit at best. It will not prolong your life by 1 day. Now, how do I approach this with my patients? I give them this information and I help them make a decision. And some of those, and I don't coerce them. I say, listen, what do you think? This is what the benefit is. Most patients look at me and say, Doc, that doesn't sound very, very good. I don't like those odds. And that's before we talk about side effects. And the side effects, actually, which are quality of life limiting, I wouldn't say they're life threatening at all, but I've seen many patients, and that varies from 20 to 50% of patients taking statins, if you look at real world data, will complain of side effects that interfere with the quality of life. Muscle pain, fatigue, brain fog, erectile dysfunction, joint pain, stomach issues. I have seen elderly patients who have been diagnosed with potential Alzheimer's disease or dementia. When you stop their statin, suddenly their memory returns. People who have been bedbound, who feel they can't move, they're just getting old, right? They stop their statin, they've been on it for years. Within weeks, they suddenly feel their energy come back. Now, I'm not telling you right now, I'm not your doctor, to do this. I'm just giving you information for you to think about and for you to discuss with your doctor. And if you want more information on this, of course, you can look at the website, thennt.com, which breaks down many different drugs on the harms and benefits, even blood pressure pills. But also, if you want, I'm not here to plug this, but I spent my career, a lot of my career researching this in detail. I wrote a book called A Statin-Free Life, and that's available online. You can look at it on Amazon. That also breaks it all down as well, and also in terms of cholesterol. Now,